You know, the big, beautiful bill isn't just another piece of legislation. It carries sweeping implications for both our health care system and national security. From Medicare modernization to the expansion of drone technology and military logistics, this bill could reshape key sectors of American life. To help us break it all down, we're joined by William Solomon and Micah Hillender, two experts at the intersection of innovation and policy. And we welcome you both to the broadcast. Let me start with you, Bill. How does the big, beautiful bill actually impact Medicare recipients, particularly around access, affordability, or this pharmaceutical innovation?
Thanks for having me. So here's the thing with Medicare. Remember, you got about probably 70 to 80 million people in the U.S. on Medicare. And this bill doesn't actually expand any Medicare drug price negotiations. And the reason why I bring that up is because for a lot of people out there, they might remember during the Biden administration, there was the Inflation Reduction Act, the IRA, where they were trying to put a cap on certain drugs within Medicare for certain particular products. So in this bill, I think what's important to understand is when it comes to Medicare and the drugs under Medicare, there's actually no Medicare drug price negotiation provisions that were set forth. What it does do is it impacts Medicaid. So it kind of, the way I would think about it is that it doesn't really cut Medicaid, but it revises Medicaid. Because remember, Medicaid is a charitable entitlement, right? It's not something we pay into like Medicare or Social Security. So the state picks up that expense, right, if you're poor under a certain income bracket. And basically what President Trump has done, which I think is a good thing, is say, look, if you're an able-bodied adult and you can look for work and you're able to work, then you should be off Medicaid. And you have to report certain things. Because a lot of people don't realize is that 40 states out of the 50 states in the United States today don't have any Medicaid regulations. And so by being able to cut Medicaid, or revise Medicaid rather, to people who really need it, that's going to give a lot of savings to the government over the next decade, probably about I think it's $1.5 trillion they're estimating over the next 10 years. So Medicaid is where you'll see some of the changes, not necessarily Medicare.
So, are we seeing a true shift toward preventive care and Medicare or care? Are these policies mostly cosmetic?
I think we are. If you think about, the appointment of RFK Jr. to the HHS and what he's trying to do when it comes to food and nutrition and a focus on what's happening even with vaccines and things like that, I think we are seeing a shift towards more preventative care. So the intention is there. I think it's really all a matter of how it's executed. But the intention is definitely there. And I think, this administration, at least from my perspective, is moving in the right direction for sure. One of the things that I think is a challenge is the fact that although in the bill, and this is to President Trump's credit, he put provisions to regulate what he called were the middlemen, the pharmacy benefit managers. He talked about that in his first administration, really when no one knew about it. These are the people that really impact drug pricing, from my perspective, coming from pharma. But that was removed from the final bill. So Congress removed it, and to me that preserves what I see as a system that's not very transparent.
So, Michael, the bill includes expanded funding for drone and unmanned aircraft systems. How significant is this in terms of U.S. Homeland Security?
There's four major things that are pull this all together. The first one is there was two executive orders just over a month ago. The first one was unleashing American drone dominance. That is to help start building drones here in the United States, and then also allowing drones to do more advanced operations here in the U.S. The second one was restoring American airspace sovereignty, which is about securing our airspace here around critical infrastructure within our cities, nuclear plants, and so on. So those two executive orders came out. Then within this big, beautiful bill, there's roughly about $13 billion that is going into the funding to support U.S. manufacturing of drones, the tools for public safety to be able to understand what's happening in airspace, uncrewed aircraft detection systems. And then finally on Friday, there was a memo out that was signed by Pete Hegseth, which is similar, is unleashing U.S. military drone dominance, which is then removing a lot of the red tape to start to build drones at such a speed and being able to push it out to our military, almost like ammunition. That's how many drones they want to produce here in the United States. So it's a big, tall order for the United States to step up, but it's exciting for our industry.
You know, speaking of this, I mean, there's just been a lot of airplanes falling out of the sky, major crashes, emergency landing. Every time you turn around, what about a need to take a look at our airspace, take a look at our air controllers at this area and have those safeguards to protect, particularly those travelers who fly the friendly skies?
Yeah, and that's part of this as well, is making sure that we don't have aircraft or drones flying into airports. As we saw last week with the floods in Texas, our hearts go out to them, but a drone did run into one of those helicopters and they had to make an emergency landing, and now that aircraft was not able to be used in emergency for the rest of the week. So this systems and this funding is also to help support our manned aircraft systems as well.
You know, Bill, I'm not here to have a Trump love fest today. What challenges do you see in the big, beautiful bill directly with the kind of technology and what we need to do moving forward in this space?
Well, I mean, and when it comes to the drug development in the pharmaceutical industry, this is a good thing because he's put a lot of provisions in the bill to help support innovation in clinical trials. So, you know, going back to pharmaceuticals, if you're out there listening and you're a patient or a caretaker of someone that has a rare disease or ultra rare disease, this bill's a good thing. This is a good thing. If you're someone that has, you know, advanced cancer or you're trying to get into clinical trials, this bill is a good thing because it actually enables pharmaceutical companies, because of some of the provisions, to invest more in research and development. I think, you know, unfortunately, when you look at what's happening, especially on the left, the story is spun that there's a lot of cuts. You know, this is going to cut science, this is going to cut research. But actually, this bill for the pharmaceutical industry is a positive, but that's a good thing because that enables them to reinvest back into research and drug development. And again, looking for new treatments for patients.
So, Michael, what role will civilian tech companies play in these military logistic upgrades? And does this blur the line between public and private defense?
It is taking commercial technology and starting to call it dual use and moving at the speed of some of these startups that are able to build drones quickly and with this technology, and then moving it faster into the Department of Defense or Department of Homeland Security or Border Protection, because we have drones, we're seeing them coming over into the U.S. and being able to move faster. So it is blurring that GovTech, but we need to move a bit faster as a country to catch up, because a lot of the technology that we're using today in our public safety and homeland security is 75% of it's made in Asia, which is an area that we need to start securing our technology and securing our airspace with U.S. technology.
So, Bill, how does the bill actually handle the cost of these advanced therapeutics, including AI-assisted treatment plans? And is there a risk of over-regulating health innovation, or does this bill strike the right balance between access and advancement?
It's a great question. When it comes to access, for some of the high-cost specialty drugs, there could be an impact there. And I think the reason is that what's going to happen is if you see some of these cuts on the Medicare, Medicaid side, or some impact there on the federal side for pharmaceutical companies, it may make it harder for some payers to pay or cover those medications. So that is a possibility for sure. But here's the thing, and this is actually related to what Michael said. You know, we talk about the influence of Asia and China in particular. You know, one of the things that a lot of people don't realize is a lot of your generic drugs, they come from China China. They're manufactured in China. They're manufactured in India. From a safety perspective, that's a concern. Remember, a lot of facilities in China and India can't get inspected by the FDA. That's a big problem. There's been a lot of issues with contamination with generic drugs coming out of those facilities. So, I like where this administration is headed when it comes to the tariffs, when it comes to incentivizing pharma manufacturers to produce domestically. So I think we need more of that. Similar to what Michael said in terms of what's happening overseas again in Asia, we want, from our perspective, as patients, we want to make sure the quality of the drugs that we're taking are high quality, that's something that we could rely on and have more assurance on. And if they're manufactured in the U.S., that's going to fare better for everybody.
Michael Helander is the CEO of Airspace Link. We thank him so much for joining us. And William Solomon is the CEO of the Accreditation Council for Medical Affairs. Thank you both. We look forward to having you back on in the future.